Hi, I'm really proud to be able to talk about this topic today because it is something that has really interested me, and I have done a ton of research and many hours, nights, weeks, months, and years trying to understand this topic better because I was beginning to approach this phase of life. The topic today is hormones and perimenopause, menopause, and HRT, hormone replacement therapy. My name is Jennifer Spring. I'm a licensed marriage and family therapist in Southeastern Connecticut, and here we go. Buckle up. I am one of 1 billion with a B women in this phase of life around the globe. We are Generation X, and what I love about our generation is that we are pesky, we are lippy, and we are impatient, and we are not tolerant of not feeling well. We want to look good and feel good for as long as we possibly could. And so we want and need to understand this phase of life and what is going on, why is this going on, and what can we do about it. There has been very little research until recently about this phase of life and HRT. And it's been really difficult for a lot of people. And so I'm going to help you understand what happened and what's happening now. So back in the 70s, I believe it started in the 70s, there was the largest to date nationwide survey on postmenopausal women. It was called the Women's Health Initiative. And this is what kind of confused us, because what happened was our moms in our generation, our moms were put on hormone replacement therapy, HRT. And during the process of being on their protocol, they were yanked off of it because the data was released from the study. And what the data showed was that the risk, basically in essence, the risks outweighed the benefits. And so it became very scary for these women and for these doctors to have their patients on this HRT. So they were pulled off of it. However, what we know now is that some of that data was skewed and the risk numbers were misinterpreted. We have since made adjustments to what the HRT looks like and how we ingest it or consume it or apply it, what exactly we're taking. We've made some changes, and the data now is showing that it is safe and effective. So in particular, we have learned that there is now minimal risk of you starting HRT prior to your last bleed. During the Women's Health Initiative, they were studying only postmenopausal women, so giving HRT to women that were 12 months beyond their last period, and not working and not applying it to the women that were in perimenopause, which is the 10 to 12 years leading up to that time. We now know that there's minimal risk if you start during your perimenopause time. We also know that there's minimal risk for women who start HRT even up to 6 years after their last bleed. We have also learned information and about that it's also safe now for women beyond their 60 years old and higher, that it's safe to even take it during those times, in those decades. As long as you're getting symptom relief, it could be super effective for you with minimal risk. We have learned that HRT reduces the risk of heart disease, hip fractures, colon cancer, and Alzheimer's disease. And we have 30 plus years of research that concludes there is no association between taking transdermal estrogen and breast cancer. So again, during this Women's Health Initiative, they were not using transdermal estrogen. They were using estrogen in a pill form that was showing to have a link with breast cancer. We are doing things differently. The way that we are taking HRT and estrogen today is showing that there is no risk. And this is huge information. And this is really good news for women. And this also, by the way, includes women that have a family link to breast cancer. They perhaps have a mother or a sister who have had breast cancer. We are showing that there's no association for you taking transdermal estrogen. We have also found out that there is no correlation, there is no link between taking, again, transdermal estrogen and progesterone with dementia, heart disease, osteoporosis, or strokes. Minimal to no risk. So this is huge news because we also know that there is nearly 100% guarantee that you are going to subside and cure your symptoms with HRT. So to know that you're going to get maximum benefit of symptom relief plus no to little risk, this is huge news. The word is spreading like rapid fire, and this is really, really exciting. So that's kind of what happened and how all this confusion started in the first place, and why women for decades were not taking HRT and just suffering. But why we are no longer doing that. The Generation X, we're spreading the word. Thank you. I mean, you are welcome to you millennials and you Gen Zs who will not have to suffer, will have all of this data, will have all this information, will be able to start as early as you possibly need to get symptom relief and feeling better and getting your body and your brain and your mental and physical health back to where it was in your 20s and your 30s. So I'm just going to do a really brief overview as to what is happening in our bodies during this cycle, going from being a healthy 30-year-old with a healthy cycle, normal cycle, to getting to your 50s-ish and going into menopause. So in your 30s, you are on like a natural, normal roller coaster ride of hormones. Your hormones, we get a period, and then our hormones continue to rise, where we ovulate at the top, our hormones come down, we release an egg, we releases progesterone, and we have a period. We do that cycle all over again. We ride the roller coaster up, we ovulate, we come down, we have a period. We ride the roller coaster up, we ovulate, we come down, and we have a period. It's very predictable. You can figure out what's going on in your system. You know what to expect. And I always, by the way, recommend to my young ladies to pay attention to their cycle, because where you are on that roller coaster absolutely determines what moods you are having and what is going on with your body, because different hormones are responsible for different things. So I often will recommend, well, back in the day before we had apps and internet, I gave them paper and had them log their charts. Now there's all kinds of apps that you can utilize to track your cycles, to understand what hormones are working when and what is going on. As we begin to approach our 40s, things begin to get out of whack. Basically, the roller coaster goes off the track. We continue to ride that roller coaster, but things aren't always happening the same. We ride the roller coaster up, but we don't always ovulate. We come down on that roller coaster, and we don't always have a period. Sometimes we do, sometimes we don't. So as we begin to go through those years, we are entering the stages of perimenopause. You're not always ovulating. You're not always having a period, which means sometimes, some months, you are producing natural, normal amounts of progesterone, and some months you are not. And those months turn into years where the progesterone is just kind of leaving the show. That is the first thing to kind of walk out the door in our life, is progesterone. And you will be symptomatic by being very tired and very moody. So I hear a lot from women in their 40s that complaining that they are feeling super bitchy, they're not sleeping well, they're having temper tantrums, they're yelling at their spouses, they're yelling at their kids, they feel like they're going crazy, they don't understand what's going on because sometimes they just hate life, they hate the world that they live in, they hate everybody around them, but then some weeks and months they're completely fine. Well, what's going on is progesterone is leaving the show. As we begin to get to our late 40s, and again, this is on average, this can happen earlier or later with some people, but on average, beginning close to our late 40s, our estrogen begins to drop too. So again, in our early 40s, we still have plenty of estrogen, but we have less and less and less and less and less progesterone. We are estrogen dominant, produces side effects. But as our late 40s and early 50s coming, our estrogen begins to decline as well. And so when this begins to happen, all kinds of side effects set in. So there's a really, really good study going on right now. Andrea Donsky, who's a nutritionist who has dedicated her work these days to working only with women in perimenopause and menopause. She's got a website. I'll get to that in a minute. But on that website, she's doing a really great study and understanding what the symptoms of perimenopause and menopause are. So let me just give you what the top 10 or 11 are symptoms. So the first thing that happens to nearly over 70% of people is they become exhausted. They are tired. They are fatigued. And that is mostly in perimenopause, again, because that progesterone is leaving our bodies and is not producing. It makes us really, really tired. But then what begins to happen as estrogen begins to fall too, the second most popular symptom of perimenopause is brain fog. Then we have sleep issues, we have memory loss and forgetfulness, and number 5, anxiety. Number 6, joint pain. Number 7, lack of concentration. Number 8, lack of focus. Number 9, hot flashes. Number 10, low libido. Number 11, night sweats. And number 12, weight gain. So she has surveyed so far over 3,000 women and again found over 100 symptoms. So if you don't have one of those, there could be so many others that you can be experiencing. Body pain, bone pain, muscle pain, hair loss, depression, anxiety, just there's so itchy skin, itchy ears, like the weirdest things are happening, and it all pertains to our loss of hormones. And it's annoying and it's unbearable at times. And again, for decades, women were doing nothing about this but suffering. Now we have learned that we can do something about it, and we are getting symptom relief with little to no risk. So what can you do? I'm going to break this down into, I think it's 3 steps. Number 1 is do your own research. We finally have resources. We finally have the information. And you want to take responsibility and become educated. It's so empowering and it's so interesting because we're all living it. And it really all makes so much sense. So knowledge is power. So when you allow yourself the opportunity to understand all this information, you're going to be able to go to step 2. But step number 1 is educate yourself. So I'm going to give you a couple names of people that I follow and I have learned from, and I have found really, really helpful for you to go and take your own look and see kind of who interests you. I've got 5 different resources, but what I want you to do is please leave a comment below on if there's somebody else that you have learned from, a book that you've read, because books are beginning to come out, which is absolutely amazing. And it's, again, everybody is saying the same information, which is really important to know too, is that it's the research and the data and what is being kind of communicated is consistent. So if there's only one person that you have time to kind of turn to and listen to, it would be this person, Dr. Mary Claire Haver, Haver. She has blown up the world on TikTok. She has over 2 million followers in a short amount of time because she is amazing. She is a board certified OBGYN who has left her very successful practice in Galveston, Texas, and is specializing only now in working with women in perimenopause and menopause. She has created what is called the Galveston diet, not meant to be a diet, but really a food plan, a lifestyle for women that are in this phase of life, that it works with their bodies and what's going on hormonally as far as food. All of us, by the way, are very holistic in our approach. We believe that for you to survive well in this phase of life, or honestly in any phase of life, in my opinion, is to pay attention to mind, body, and spirit. You've got to pay attention to your nutrition, in particular, high amounts of protein and high amounts of fiber. Eat real food, stay away from processed food, stay away from food in boxes and bags. Do the best that you can taking care of your nutrition. You need to exercise. You need to have supplementation, which is in another episode that I did before this one. And you need to sleep well. And if I didn't say exercise. So we all really believe in that. But Dr. Mary Claire Haver is just fantastic. She does have a website, but follow her on TikTok. Dr. Fiona Lovely is the first person I started following. You can follow her on Facebook, but she has a podcast that I highly recommend you download called You're Not Your Mother's Menopause. She has been around for years. Her episodes are short, and she's interviewing and giving you tons of really good information. She is a functional medicine doctor, and I will address that in a little bit. And she has really, really good information. Dr. Anna Garrett, Garrett, she has a book out and a website as well. Both her and Dr. Fiona Lovely are out of Canada. You can follow Dr. Anna Garrett on a private Facebook group called Hormone Harmony Club. You do need to request to be in that. Let her know that you are in perimenopause or menopause, and you will be accepted into that group. There is all kinds of information about women who have used her. You can hire her actually to be your doctor. She will work with you virtually, and she will order all kinds of labs for you. She will do a consultation before, during, and after. She's a little bit pricey, but if you can't find somebody locally, she could be an option for you. Andrea Donsky is who I referred to about the study earlier. She's the one doing all this research to understand all the symptoms that we women are having during perimenopause and menopause. She has a website called wearemorphusse.com, MORPHUS. She has also launched a line of supplements that are said to be clean. What it says to be in it are actually in it. And she is really dedicated to this world of supplementation and creating supplements for us to take that are safe and effective and affordable. Again, I did my episode on supplements and the episodes prior to this one, so tune into that. She also has a podcast called Menopause Reimagined. Go ahead and download that. She interviews somebody different every single episode. She is not the expert. She is interviewing the experts to for us to get all of this information. It's really, really a good one. And the last and final podcast that I would recommend downloading is called The Hot Flash Inc. She, Dr. Anne Marie McQueen, has a website and a podcast. But again, if you know of somebody that you have found really, really helpful to you, please put that in the comments below so that when other women are listening to this episode, they can read those comments and continue to get different resources, books, and names of people. So thank you for doing that. Okay, so step 1, educate yourself. Step 2, find a qualified and competent doctor. This is really important. It may or may not be your OBGYN that you've been working with for many, many, many years. The problem that has happened is a lot of docs out there have the old data. They don't have this new information. They're not on TikTok. They're not on all these podcasts like we are. And in some circumstances, we as the women are bringing this information to the doctors. So 2 things. One is if your doctor says, no, HRT is a no-go, I'm not prescribing it for you. Well, give him or her the information so that they might be able to explore it themselves and be willing to change their mind and prescribe it for you. If they do not, find another doctor. Do not give up, because there are lots of other docs out there that do know this information, have the data, have the research, and are willing and more than willing to prescribe HRT for you. So, how do you find another doctor? Well, ask around. We are pesky Generation X's. We are talking about this. We didn't talk about a lot growing up, but we are talking about this because we want to feel good and we want to look good. So talk to your friends. Word of mouth is a really important way of doing everything, right? So see who they're seeing. And again, in the comments below, please put down who you are seeing in what area of the country you live in, and provide contact information for that particular doctor, because we need to know who's doing this. Ask your pharmacist, your local pharmacist, who in this area is prescribing HRT. Please give me their name and please give me their contact information. And if you still can't find somebody, consider working with a functional medicine doctor. So functional medicine doctors are a little bit different than MDs. They have a specific training in functional medicine. And basically, they are very holistic in their approach, and they want to know why. Before they push pharmacology, they are doing lab work, blood work, food intolerance testing, all kinds of tests to really understand why you are symptomatic, why you are experiencing what you are experiencing. And they are going to encourage nutrition and exercise and stress management and sleep, but they're going to give you the tools and perhaps supplements or other things, other ideas of how to address those issues that are impacting your health. You can find a functional medicine doctor through their website, and it's called ifm.org. It's the International Functional Medicine website. There is a practitioner list. You put in your zip code, you put in your state, and the radius of how far you're willing to travel to get to this doctor, and they will provide you a list of practitioners that are at least listed on that website. There's also another website called menopause.org. This is the North American Menopause Society website. Again, a list of practitioners. Type in your state and your zip code, how far you're willing to travel, and there will also be a list of practitioners. Now, I went on both of these websites and did this, and I have seen 3 really, really qualified, high qualified, super competent functional medicine doctors in my area, and neither one of them were listed on either of these websites. So I caution you to not have this be your only way of going about finding a really good doc that knows all this information. I've never heard of a functional medicine doctor until I did hear of one. You don't know what you don't know. And I want to spread the word, because to me, this is like a gift from God, because again, this is how I think. I want to understand why, and I want to address the underlying root of the problem, which is going to fix the problem, as opposed to just taking medication. Okay, so that is how you find a doctor. The third step in this journey is to get your hormones tested. Now, when you're working with a competent and qualified functional medicine doctor, they're going to know to do this. So you need to get your hormones tested frequently throughout this journey. I truly believe in it for supplementation. I talked about that in my last episode, but it's really important for you to do in this journey of understanding where you are with your hormones. So when you're in your 40s, you should really be getting, or when you turn 40, and hopefully maybe this will become protocol for the insurance companies when we address preventative healthcare. All of our preventative healthcare is covered 100% by the insurance companies. Our pap smears, our mammograms, hopefully someday this will be as well, for us to get our hormones tested and to address any hormone deficiencies. So in your 40s, early 40s, get your baseline. You might have other things going on that are affecting your hormones, but other things that you want to address first before you start taking hormones. You want to look at your adrenal glands. You want to look at pregnenolone, which is the mothership of hormones. If that is off, all of them are going to be off. And sometimes that is thrown off in the beginning stages. You want to explore food tolerances that could be affecting how you're feeling, or how your gut is doing, or how you're sleeping, and what your mood is like. So that is something to do early on. As the years go by, and in that decade of your 40s, your progesterone is going to start leaving your body. It's the first thing to walk out on us. So you are going to see in your labs and in your blood work how these numbers are declining. The next step is when and if you are at the point of needing to replace that progesterone because it has left you, you are going to start your HRT. The first thing you're going to do is add progesterone. You may need years of that perhaps before you're going to replace your estrogen. It takes a while to start to finish, 10 to 12 years, they're saying. And like I said, progesterone is the first thing to go. So when you replace your progesterone, what they did in those early decades before, which is found to be dangerous, they took progestin. We are no longer doing that. Progestin is dangerous. We are now taking a bioidentical progesterone, okay? It's also sold as prometrium. It's the same thing. Make sure it says prometrium or progesterone. You're gonna take that in an oral pill or a compounded cream, okay? So a cream, it comes in like a syringe where you just kind of push out a very little bit and you put it on your areas of your body that you have thin skin. Same thing. There's also a pump that does the same thing. The compounded creams tend to run about $40 a month. I take an oral pill. I find that to be the most helpful. I take that at night and it's about $18 a month. The next thing you're going to add to your regime is estrogen, if and when you're ready. And again, that could be years later. Sometimes when you're taking progesterone in the early stages, it's a bit tricky because again, we have a lot of estrogen going on. So sometimes you need the progesterone and sometimes you don't, because sometimes you're ovulating and sometimes you're not. Sometimes you're having a period and sometimes you're not. So it can be a bit tricky, and you could be symptomatic those months when you're taking your progesterone, but you don't need it because you ovulated or you had a period. I wish I can go back. I stopped it at that point because I was getting frustrated and I didn't know what I know now. This was 5-8 years ago. We know so much more. I wish I pushed through all of that and just suffered 1 or 2 months not feeling my best because I had too much progesterone, because with every month that went by, I was producing less and less and less and less. And again, I know this because I am doing my labs and getting my blood work and seeing the decline in the numbers. When you are ready and when it's necessary for you to add estrogen, what they did years and years ago that they found to be related to breast cancer and clotting, which was dangerous, was they were taking a pill. We are no longer taking a pill. When we take a pill and it goes through our GI tract of estrogen, it is increasing the clotting factor, and that is what's leading to the sorry, bear with me. That is what's leading to the heart disease and the strokes. So no more pill estrogen, no more estrogen pill. We are doing a transdermal estrogen only. Transdermal means we are putting it on the skin. It comes in the form of a patch, a cream, or a gel. I take the patch. It's about $35 a month. You are never pulling this thing off of me. I feel significantly better since I've replaced my estrogen, because again, like I said earlier in this episode, when we begin to lose our estrogen, that's when things really go haywire, and those 100 symptoms really begin to bother us and affect our lives. The final hormone that is often replaced is testosterone. If and when you are ready for testosterone, your best bet is a gel or a cream. My insurance will not pay for me to take a gel or a cream. And if I pay out of pocket, it's about $200 a month, and I am unwilling to do this. Not all women want to take testosterone or feel like they need to. I want to, because I want to maintain my muscle mass and stay toned and have plenty of energy. I take a compounded pill that I get from a compounding pharmacy, and it costs me about $30 a month. The jury is out on this, on how effective it really is. I'm waiting to get my blood work back, and I will make adjustments accordingly. So that is what you should do. This is why this has happened, and this is what you should do. Again, low risks and huge amounts of benefits, symptom relief. We are finally feeling better, and I'm so excited to share this information. Do your own deep dive, educate yourself, go to your doctor, and make the decision that is best for you. Again, please leave comments below on what I've missed, who you see, what you're taking that might help other women, and who you're getting your information from, what books you're reading, what websites or what podcasts are you following. Again, please subscribe down below. I'm trying to hit my goal of 1,000 subscribers, and I appreciate your time.